World Stroke Day is observed every October. It is the second leading cause of death around the world, but many Americans don't know how to recognize one. Dr. Nidhi Kumar is on call this morning with the signs everyone needs to know about this medical emergency. Good morning, Dr. Kumar.
Good morning.
Okay, so can you explain what a stroke is and who's at greatest risk?
Well, a stroke results from an interruption in the brain's blood supply, and depending on the part of the brain that's affected, people can lose the ability to speak, they can lose the ability to move a side of their body. Now, there are 750,000 strokes in the United States every year, and we think of stroke sometimes as something that affects older patients, but it can happen to anyone at any time. Hypertension, high blood pressure is the biggest risk factor for stroke, but smoking, diabetes, even pregnancy can put you at risk for stroke. And Black and Hispanic patients are at higher risk for stroke than patients of other races.
What actually happens to the brain when you get a stroke?
Well, there's two broad categories of stroke. An ischemic stroke is when there is a blockage in a blood vessel. That can happen because of a buildup of fatty deposits, or they're called plaques, or that can happen because of a blood clot. Alternatively, there are hemorrhagic strokes, which happen if someone has a bleed within their brain or around their brain. Now, this causes brain tissue to become damaged. And the extent of what manifests is how much brain tissue is affected and how soon you can get treatment. Time is of the essence in stroke.
What are the symptoms we should look for?
Well, there's an acronym, B FAST, and the American Heart Association released an acronym in Spanish, RAPIDO. So B FAST, B, look for issues with balance. E, eyes, visual changes. F, facial drooping. A, arm weakness. S, slurred speech, and T is time. And I really want to emphasize that, because minutes, it's not just about minutes, it's really seconds that count. And the sooner that you can get medical attention, the better the outcome.
What can we do to prevent a stroke?
Okay, well, if you have high blood pressure, you really want to get your pressure under control. Every 10-millimeter drop in blood pressure can reduce your stroke anywhere from 30 to 50%, depending on your age. Diabetes, keep that sugar under good control. Diabetics have 2 times higher risk of having a stroke. Smoking cessation, exercise goes a long way. People that exercise moderately can cut their stroke risk 30% and then get those cholesterol numbers where they need to be.
I need to work on that, the high cholesterol. No, really, I do.
Yeah.
There are strokes I've heard that people don't even know they're having.
So it's interesting, because while most strokes, people will experience symptoms within minutes, for certain types of strokes, particularly hemorrhagic strokes, it can take hours or even days. So you really want to be very cognizant of those symptoms. If there's some subtle changes in speech, cognition, or balance, take it seriously. Go and get checked out. It never hurts to be more conservative and get checked out.
All right, Dr. Nidhi Kumar, thank you so much for being with us. You always have such good information.